Hey guys, welcome to Localite. It's great to have you with us. You know, living in the Gorge has already got plenty of benefits. It's definitely a great place to live, but you know what? It's recently got even better. And what I'm talking about is Telestroke. And Telestroke is something where somebody, a doctor actually, can look at and diagnose symptoms of a stroke virtually. And Dr. Wilhelm is here from Hood River Providence Memorial Hospital, and he's going to tell us all about it. So welcome. It's good to have you.
Good to be here.
Yeah. So let's talk about this. What is Telestroke?
Well, a telestroke is a telecommunications device where we are able to invite or bring in a specially trained neurologist from the Portland area virtually into our emergency department to help us with the treatment of stroke.
Okay, okay. So you guys recently had a demonstration, almost I guess you'd call it a mock stroke victim that came in, and you performed all of this, and it was filmed and so forth, and you actually had a doctor from Portland who operated the Telestroke equipment. In what the equipment? Tell me a bit about that, because it's pretty cutting edge.
Well, we call it a robot, but it's not in essence a robot. It's a sophisticated, secure telecommunication device, kind of like for our computer friends, like Skype. It allows direct two-way communication between myself and the physician in Portland. But not only is it communication, he can look at the CAT scans, he can look at the labs, he can look at EKGs, he can look at all the data in real time that we've collected for him to help him make a determination on how to help us treat this patient quickly. Okay. And not only can he see this information, but he can interact with the patient. He can focus in on the patient. He can pan around the room. He can look at resources. He can see what's going on.
So he actually can completely control the device, where
Correct.
The camera. So he can look on your left side or your right side, or look at maybe the vital stats that are being displayed, all of that.
Correct.
Okay.
So it's not a static device.
Okay, okay. And it's all done over like a secure connection.
Correct.
So nobody can hack into it. Nobody has to worry. Of course, if you're having a stroke, you're probably not too worried if somebody's hacking in and looking at what's going on, but it is on a secure connection.
Correct.
And what other reasons is that significant for? It being on a secure connection?
Well, it has to be secure for healthcare reasons. We have a law called HIPAA where you have to keep patients' information private. Mm-hmm. And so that's one of the main reasons, is you can't just do this over a telephone line or an internet line, because you have to protect patients' private information.
Okay, okay. And the response time for a stroke victim is extremely important, and Telestroke enables you as a doctor to be able to close that window a bit.
Correct.
And be able to get that victim in front of somebody who is specialized in knowing what might be happening and identifying those symptoms, I guess. Is that true?
Yes.
Okay. And we had, I believe it was Chad or Chief Ludwig. Mm-hmm. Is that and he was actually an actor, and he was the person who was the mock victim.
Right.
And tell us a bit about that. How was that?
It's always interesting to interact with someone you work with. It's a little bit intimidating at times, and it's intimidating to be in front of a camera to do this. But it was not just so much for the acting of acting this out. It was for helping us to explore what the weaknesses and strengths of the system, to build our team so everyone knows what their crucial role is when the first time this happens for real.
Okay. And so what did you guys learn from that experience that really, because you haven't actually had a victim that you've had to use this on yet, is that correct?
That's incorrect.
That's incorrect, okay.
I believe so far we've had 3 people use it in about the last 2 weeks.
Really? Mm-hmm. Wow, so it's already being implemented.
Correct.
That's great. So what do you think is the biggest, I guess, what would be the biggest advance by you having this? What would be the biggest advance that this gives our community?
Well, it brings in physicians who are specially trained in the treatment of strokes right into our living room. Hood River is a rural community. We're 60 miles from Portland, and it helps us to make a determination as to what sort of intervention we need to do in a quick fashion to get people the best care.
Okay.
As we say with strokes, time is brain. And so it's very crucial to take care of a person with a stroke as expeditiously or as quickly as possible, because the longer you mess around trying to figure out what you're going to do and you don't have the intervention of a specialist, the more brain tissue dies, and when brain tissue dies, it's gone.
Okay. Is it typical that in smaller communities like Hood River, for instance, that there wouldn't be a specialist that knows exactly how to address the symptoms and so forth of a stroke, and therefore needing the telestroke technology?
Yeah. Well, I think that most physicians have an idea of the essence of stroke, but the care of stroke is changing fairly quickly.
Okay.
And for individual physicians to be up to date on the latest cutting edge things, I think is difficult.
Okay.
And so when you are able to harness the power of a small number of physicians in a metropolitan area like Portland who are the experts in their field, and they can bring that knowledge to us, I think it's going to benefit the patient.
Yeah. All right. Well, you guys stick with us. We're talking with Providence Hood River Memorial Hospital here on Localite. We'll be right back.